Alright, so we are trying to understand the postural writing reflex. If you're preparing for NPT, watching this NPT strike videos, this is completely free. We're giving completely free, and it is important to more than memorizing, understanding what these reflexes are really. Now, when you say writing reaction, postural writing reaction, this is happen once once your primitive reflexes and dissociate or diminishes once the cortex start to develop, right? So the other one is subcortex, right? It's if you look at all these primitive reflexes, these are um, these are not mature. These are subcortical, right? So this primitive reflex are driven by subcorticals. Once you start developing, your brain start developing, cortex start to take up, all these primitive reflex started to diminish, but some of them stays there. And if you watch the video earlier, you really know what is all these, and you probably understood what is primitive reflex. Now we are looking into the postural writing reaction. These are the states that are voluntary and persist for life, okay, with some expressions that we are going to exceptions that we are going to explain. Now if you really want to understand the writing reactions, you need to know writing reaction, what is it, right? So these writing reactions are all about keeping the head vertical and the body aligned when things get tilted. So the idea here is our body is trying to maintain a balance, right? So keeping the head vertical and body aligned when things get tilted. So suddenly you feel that your body is tilted, you are trying to bring your head back into a normal, aligning the body with the gravity and horizon, right? So the whole idea is when body get tilted, how we are maintaining your head straight and body aligned with the things, and body aligned with things get tilted. So there is something called labyrinth writing. So what it looked like, the examiner blindfold the infant and tilts the body to the side, forward or backward, right? And the infant automatically orient their head back to upright vertical position using their inner ear vestibular system. So in inner ear, there's something called labyrinth system, which is giving that sensation of the loss of balance or how to balance it, right? When so the body is giving information from that, and when you tilt the baby is trying to bring back to a neutral position or vertical position, maintaining the head. So that is the vestibular system. Now, so that's what say labyrinthic writing. So this will comes around 2 months and it will be lifelong. So the writing reaction generally, the idea is emerges around 2 to 6 months. Foundation for is a foundation for upright body, right? So you have some they have some pictures of that. We look into that, but before that we need to look into what is optical writing is. So optical writing, what it look like, exactly the same as labyrinth writing, but the baby is not blindfolded here. The other one, it was blindfolded, but he is not blindfolded. The baby uses visual cues from the environment to keep their head upright against the tilt. So instead of when the labyrinth write, we are closing the eyes. So the only system that gives the input is from the vestibular labyrinth system, right? But here the eyes is open, so they can take visual cues to maintain the vertical orientation of the head. That is again 2 months to lifelong. Now body on head writing, what it look like, the baby is in prone or supine on a mat. The touch pressure of the body against the floor cues on the baby to lift their head up into a normal position. So they are getting sensation from the floor, and that is helping the maintain the body, the head position, right? So the baby is upon or supine on the mat. Touch pressure of the body against the floor causes the baby to lift their head up. That is called body on head. Now this is again emerges and then up to 2 months, around the 2 months, and it will be lifelong. Now we have one more that is called neck on body writing. What it look like, the examiner turns the baby's head to one side while they are lying on the back. So rest of the body follows, rolling over like a log or segmentally shoulder later. So segmentally later on. So what here happen is you put the baby uh, head to one side. while they are lying on their back, right? So baby is lying down and turn the head to one side. So when what happen is, once you turn only the head to one side, the body will follow that head like a rolling over. So that is called neck on body. Now the other one is called equilibrium reaction. Now understanding this, this is called the tilt board group. Okay, so these reactions occur when the entire surface underneath the baby moves. The goal is to keep the center of gravity inside the base of support. So you know there's a base of support and it changes with the height or width of how you're standing. The equilibrium reaction, instead of the body shifting, the base of support is changing. That is called equilibrium reaction. So you have a prone supine equilibrium. What it look like? The baby is lying on a tilt board. When the body is tilted to the left, the baby trunk curves to the right. And the right arm and leg extend to abduct to balance. Then we have sitting and standing equilibrium. What look like? The child is sitting or standing on a surface that get brighter or tilted. They will automatically curve the trunk towards the elevated uphill side and extend the limb to avoid falling over. If we standing displacement too large, they will take a rapid step to catch themselves. So the whole idea is equilibrium reaction. The surface is changing, so their body will adapt to maintain the balance and non-fall. Okay, so we have the specific way they are, how they are balancing. It's already written here, so you can use there. Okay. And then we have something called a protestive extension. So this is called parachute. So this is something that we mentioned on a primitive reflex. Also, if you see that on the one of the last one that we mentioned on the primitive reflexes, this parachute, and this is considered as one of the most important one, and that is a permanent reflexes or a writing reaction. These are emergency reports response to rapid sudden loss of balance. The limbs extend outward to break a fall. So what it looked like, the examiner hold the infant securely around the waist and quickly stimulate a fall forward to the mat. The baby immediately extend both arms forward with the hands splayed out to catch themselves. So you're holding the baby like this, suddenly drop, the baby will bring their hands up like they're trying to uh, catch themselves. So you can do a sideward parachute will look like while sitting. The child is gently but quickly pushed to one side, arms on the same side, immediately shoots out laterally with an open hand to prop themselves up. This, then they will lift their hand. And there is downward one. The examiner holds the infant vertically the air and plunges them quickly downward toward a surface. Both legs immediately extend, abduct, and extend and rotate, prepare for landing. So that would be like this, drop it down like that, and extend their legs immediately and abduct, extend, rotate, prepare for landing. Okay, so that is all the writing reactions. So your body is trying to tilt, the head is trying to maintain the vertical position. The equilibrium, you're changing the surface, you're changing the base of support with the gravity. So that is the equilibrium bond. If you want to go into the specific details of the response, it's written here, so you can follow that. And the timing, mostly the chances are mostly from the primitive reflexes, and how is it, if it persists, how it's going to delaying certain activity. That is what should be your focus on this part for your exams. Okay. So consider this one as the most important. I will say how ATNR, STNR, TLR interfere with the development. So ATNR is asymmetric tonic neck reflex, persist past 6 months. It will prevent the child from bringing hands to midline, prevent rollings, and prevent bilateral hand use. Okay. Then we have STNR, symmetric toning of persistent past 12 months. It will prevent hands and knee position. Right. So this one will prevent going into quadruped position. It head flexion cause arm flexion, leg extension. Child will collapse, and head extension cause arm extension. Child cannot maintain these positions. Right. Also, tonic labyrinthic reflex persists past 6 months. Excessive flexion cannot lift head or extend, and supine excessive extension cannot flex to sit up or roll. So this is something you should really understand and keep in mind. And this will be the most important if you're looking to learn the reflex. on the pediatric part. Okay, now we will answer some of the so what will I say, if you really want to understand these reflexes and the writing reactions, you can go into the YouTube and watch some of the reflexes there, so that will stay in your mind forever. Okay, so that's what I did to memorize this, because memorizing this without understanding won't be really hard. Okay, so we're going to do some of the MCQs, and then we go into the section number 3, which is cerebral palsy. A lot of the questions coming from here also.